everyone, welcome back to our Fine Nursing Tutorial YouTube channel. In this class, we'll discuss important MCQs. Who all have visited first time on the channel, please do subscribe and watch. We'll see the first question. Which infection is most commonly associated with infertility? Gonorrhea. The earliest sign of pregnancy is amenorrhea. Hagar's sign is softening of uterine isthmus. Chadwick's sign is bluish discoloration of cervix. The phytograph is used for monitoring labor progress. Folic acid supplementation prevents neural tube defects. Normal weight gain during pregnancy is 10 to 12 kg. In pregnancy, cardiac output increased by 40%. The normal duration of third stage of labor is 5 to 15 minutes. Apgar score is taken at 1 minute and 5 minutes. Which is the most common presentation of fetus? Vortex. The umbilical cord normally contains two arteries, one vein. Polyhydramnios means amniotic fluid more than 1500 ml. Oligohydramnios means amniotic fluid less than 500 ml. The drug used to prevent recessive isoimmunization is anti-D immunoglobulin. The ideal time to give anti-D injection is within 72 hours after delivery. The most common ovarian tumor is cystadenoma. The commonest site of fertilized ovum implantation is fundus of uterus. The most important symptom of placenta previa is vaginal bleeding. In abruptio placenta, the bleeding is usually painful. The hormone responsible for relaxation of pelvic joints is option A, relaxin. The most common cause of neonatal death is prematurity. Bishop's score is used for assessing cervix readiness for labor. The average crown length at 12 weeks is 8 cm. A condition where the uterus is absent that is Rokitansky syndrome. The commonest cause of maternal death in early pregnancy is ectopic pregnancy. The gold standard investigation for ovarian tumor is histopathology. The earliest sonographic evidence of intrauterine pregnancy is gestational sac. The most common cause of infertility in females is PCOS, polycystic ovarian syndrome. The commonest cause of postpartum sepsis is endometritis. The commonest site of genital tuberculosis is fallopian tube. The safest contraceptive method during lactation is injectable progesterone. Please like, share and subscribe to my YouTube channel for more informative content. Thank you for watching.